What do patients really want? Do they want freedom of choice or do they want freedom from choice? That's just one of many things we're going to be talking about on today's podcast. Welcome to the Dental Practice Fixers. I'm Dr. Richard Amato. I'm co-founder of the Amato Center, and I'm your host on the Dental Practice Fixers podcast. We've got some really cool stuff for you today, stuff that will make you think. Dangerous, huh? Stuff that will make you think. And then, of course, our mystery shopper calls. But just a quick note about those DSOs. Some people love them, many dentists hate them. I think there's no love or hate. It's just they exist and we got to deal with them. One thing that DSOs can do that might drive us a little crazy is because of their huge, massive buying power, they get cheaper prices than independent dentists on anything. But that is until now. And that's why I want to tell you about DDS United. It's a group purchasing organization for all of us as an individual dentist, practice owner, team member who orders supplies. You can join and you'll get incredible discounts on all your dental supplies, even from direct companies like Kettenbach. And then it goes on with lab, implants, so many different things you can get. And you can lower your overhead like the DSOs do with the same high quality products you're probably using now. So go to madow.com/united, madow.com/united. And there's an extra special reason I want you to use that link, and that is because Madow friends, and that's you, do not pay the monthly membership fee. So go to madow.com/united, start saving on dental supplies, implants, lab, all kinds of great things immediately. I'll see you there. Okay, so let's talk about today's topic. We're going to do a little throwback to the band Devo. Some of you may remember Devo from way, way back when in the late 70s, early 80s. I think they're actually making a comeback on their own tour. I did hear that somewhere, but they had a lot of great songs. One of their songs, they said, freedom of choice is what you got. Freedom from choice is what you want. And I always was intrigued by that line, even when I heard it way back when. Freedom of choice is what you got. Freedom from choice is what you want. Now, just to be clear, I'm not talking about political stuff or about the fantastic rights that we have in the US and probably wherever you're listening. I'm not talking about that kind of freedom of choice or freedom from choice. I'm talking about sometimes when you have to make a decision, it's easier just to be aware of the right thing to do and not have all these other choices drag you down. And then you get caught in paralysis by analysis. I'm going to give you a couple examples. After this was kind of off the wall, but after many years of service, my trusty brown loafers finally bit the dust. So, I did what anyone does when you're looking for something new. I went to Amazon, of course. Now, Amazon, several years ago, they purchased Zappos, which was a great shoe buying website. So since that happened, I mean, in the old days, if you went on Amazon to buy shoes, it was just like cheap plastic crap and knockoffs. But now you can get anything there, from really low cost shoes to the top brands, even some really high-end handmade shoes. Everything is available on Amazon. So over the last week or so, it's been like the brown loafer Olympics in my condo. I mean, there are boxes everywhere. I've not had this many unworn shoes in my closet since I sold women's shoes out of my college dorm room. Yes, I did. That's probably a story for a different day. But here's the thing. It's a big letdown. Yes, I've got boxes of shoes piled up, but one pair is too tight, one is too loose, one doesn't look like the photo, one, the color is wrong, one is downright fugly, one gave me blisters on my feet just by looking at it. It's been a brown loafer disaster. And I've had way too many choices. I mean, Amazon is great. I hate to say it. I don't know if we could live without it these days. But when you're overwhelmed with options, it's easy to get stuck in that decision paralysis. Yes, it's a first world problem, but it's a problem nonetheless. And I swear, if there were a service that could just scan my feet like we scan people's dentitions, understand my style, look in my closet, and just say, this is the one perfect pair. It will be the perfect pair of brown loafers for you. I would pay retail plus a fee just for that service. Unfortunately, that service doesn't exist, but that's kind of how I feel about presenting treatment options to patients. This is counterintuitive to so many things that we've learned, but I think sometimes we give patients too many choices. Many times, even two choices is too many choices. How would you feel if you had like a really gnarly looking mole on your arm and you went to the dermatologist and they were indecisive about what you had to do, or they gave you way too many choices. You can do this, or you can do that, or you can wait, or we can do a biopsy. We can just rip the whole thing out, or we can see if it's got cancer and it spreads through your body. I mean, I wouldn't like that. I want them to say, this is what we're going to do right now. Right now. And I think when we overwhelm patients with choices, even two choices sometimes or three choices, yeah, we could do this, we could do that, we could watch it, we could wait and see. We're doing more harm than good. It becomes confusing. The patient gets caught up in paralysis by analysis. And just like with the shoes, I'm sending all these boxes back. The patient equivalent is they walk out of your office and they don't do anything. Oh, I got to talk it over with my spouse. I got to do it when my uncle straightens out, whatever it is. But when you look a patient straight in the eye and say, I know exactly what the problem is, and this is how we're going to fix it, it shows so much confidence. It shows clarity. In my opinion, it's everything a patient wants to hear. I know what the problem is, and this is how we're going to fix it. And then you combine that with some really great financial options, so money's not an issue, and your team is professional and calm, and you're offering something much better than Amazon. You're offering better than Amazon Prime. Ooh, is that possible? You're offering excellent dental health, no wishy-washy BS. I know what the problem is, and this is how we can take care of it. Now, there is one exception for certain patients, maybe the skeptical, the cynical, whatever. I'd like to offer the choice of doing nothing. This is different than offering compromised treatment or saying, here are some different things you could do. You say, look, one choice is to do nothing. But if you do that, you better tell them the ramifications of doing nothing. And you better make it sound bad, because it is. Things always get worse. They always get, in dentistry anyway, they always get worse. They always get more expensive. So remember, when it comes to patient treatment, freedom of choice is what you got, but freedom from choice is what they want. And sometimes the choice of doing nothing is a valid one to offer, but I think mostly we need to be confident and strong in our decision-making ability and our diagnosis, and look the patient in the eye and sincerely, with a smile on your face and love in your heart. We can't forget that. Let them know what they need. It's a win-win. It works. It's awesome. Okay, that's our thought for the day. Now we've got some mystery shopper calls to do. But first, I want to remind you that we talked about lowering overhead already today. Another sure way to lower overhead is to stop paying those nasty credit card overage fees, a percentage to the credit card processing company every time a patient pulls out their plastic. Do what we do at the Matto Center. Use Stacks, STAX. Just go to matto.com/save, and you'll see how that low, flat monthly fee can save you money on your credit card processing. We've saved tens of thousands of dollars by doing it, and you should too. And of course, as I mentioned at the top of the podcast, matto.com/united will hook you up with a group purchasing organization made just for you. Independent and small group dentists, DDS United. You'll save just like the big DSOs do, which will keep your independence. So go to matto.com/united. Okay, let's do some calls. I'd love it when I start a call by asking, or by letting them know that I'm a new patient and I'm interested in coming to their office. I always think, how can they mess that up? I'm calling saying that I'm a new patient who wants to come to your office. So let's see how 3 practices handled that call. Okay, Command Central is at the ready, I think. Here is call number 1.
Thank you for calling Dental. How may I help you?
Can you tell me how much it costs for a checkup and cleaning for a new patient?
I'm not sure. They don't give us those prices, so I won't be able to give you an estimated price.
Oh, are you actually in the office?
Yes,
But you don't know the fee for a checkup and cleaning?
that is correct.
So it's just like I have to show up and then take my chances?
Well, you show up, you come, you can get a consultation, which doesn't cost you anything, and the doctor, based on what he determines needs to be done, he will do a treatment plan, and on that treatment plan, all the costs will be on there.
Okay, I see. And then what if I have insurance?
And your insurance, if you are coming in for a particular thing, then once that service has been provided, then your insurance will be, they will submit the claim for your insurance.
Mm-hmm. And then I'll find out if it's covered once they submit it?
Yes.
Okay, great. Well, thank you so much then.
You are so very welcome, and you have a
All right.
great day. Bye
Oh,
bye.
you have a super cool day. Thanks.
I love it when they she hung up on me. I love it when they get really friendly at the end, but still don't offer the appointment. Like, what's the good of being friendly to a potential new patient if you're not going to offer them an appointment and get them in your practice? I made it very clear that I was a new patient looking for a new dental practice. What kind of, I don't know first of all, they're not prices, they're fees. Let's be professional here, but I don't know the prices. What kind of person answering the phone in a dental office isn't aware of the fees? She made it like a big mystery. Then she did say that I could come in for a free consult. Okay, getting a little bit better. Knew nothing about insurance coverage. Getting a little bit better, but then told me I could come in for a free consult, but didn't encourage me to do so. Didn't offer the appointment. Phew, that was, I mean, horrible at best, I think. Okay, I know this next office is going to do better. Let's see how they do.
This is Kathy. How may I help you?
Hey, Kathy, how much is a checkup and cleaning for a new patient?
Okay. You'd be a new patient?
Mm-hmm.
Okay. Well, it depends on what type of service you have. Whether you need a standard cleaning or a different kind of cleaning, like a deep clean. How'd you hear about us?
Oh, well, how do I know?
I'm sorry?
How do I know what kind of cleaning I need?
Well, you would come in and we would do an exam for you and x-rays, and it would be able to tell you what type of cleaning that you would need, whether you would need the standard cleaning or whether you would need a more deep cleaning. And we can tell that by doing an exam and taking some x-rays.
I see. Okay, so it's a different cost for the standard and the deep.
It does depend. Yes, sir. Yes, there are different costs. I'm sorry, cut out. I didn't hear you.
How deep is the deep cleaning?
Well, it usually depends on, from the exam. It depends on how long it's been since you've been to a dentist. How long has it been since you've seen someone?
It's been a little over a year, maybe. It hasn't been that long.
Okay.
Yeah, and also I have dental insurance. It's called Dental Delta Dental, something like that. Do you
Delta
accept
Dental?
that?
Uh-huh.
Yeah.
Uh-huh. Okay. And that also does, factor into the fee for the service. We could do a benefits check for you and find out exactly what your out-of-pocket would be when you come in for your appointment. And that way you would know exactly what you were expecting to pay before we did anything.
I see. Yeah, I thought that with Delta, the cleaning and checkup was free, though, but I guess not. I thought there was no copay for me.
We are not a preferred provider with Delta Dental. We are a preferred provider with Cigna. We can definitely file your Delta Dental insurance for you, but we would not be considered an in-network dentist with them. So if you go to an in-network dentist, that usually leaves no copay, but with us, it's a possibility that you would have, no out-of-pocket, but we wouldn't know until we did a benefits check for you.
I see. I'm sorry to barrage you with all these questions, but why aren't you in network? What does that mean? Like why are you not in network and another dentist is?
It just depends on the dentist whether or not they decide that they would like to go with the dental insurance network or whether they wouldn't. We're in network with Cigna, and that's the only insurance company that we participate with. Really, is just kind of what the dentist decides which network they're going to participate with and which ones they're not.
And what is that based on?
Well, I guess it's the preference of the dentist, because you don't have to participate with a dental insurance company if that's the choice of the dentist, or you could participate with all of them if that's what the dentist prefers. It's really a preference on what the dentist chooses to do.
I see. I asked you a million questions. I appreciate your patience. Thank you so much.
Sure, not a problem.
Okay, bye.
Mm-hmm. Bye.
Okay, let's work backwards here. This call, I'm looking at my computer, was 3 minutes and 46 seconds, 4 minutes of her time. That's a long time that she invested in me. And look, I know the old expression, time is money. It's true. Time is overhead. She invested 4 minutes with me, and she was friendly enough, but she never offered me an appointment. That investment paid off zero. Had she offered me an appointment and I took it and I came in, that would have been a great investment of her 4 minutes, but she didn't. She made it bad, bad. Okay, we'll go backwards here. And I have to admit too, my phone was cutting in and out, so I didn't hear some of the things she said. So if it sounds like I responded in a weird way, I really couldn't hear some of those things. She kept saying benefits check. Is it just me? Or I noticed that when an office uses that phrase, I don't know who's teaching it out there. I guess someone is. That when an office uses that phrase, they're always trying to sleaze down a little bit and like cover up the fact that they're not in network with this insurance. They won't admit it. And then they're saying, come on in for a free benefits check. And then they kind of blindside you when they knew all along they weren't in network. I like honesty. I kind of pushed her on it and made her admit that they weren't participating with Delta, but I don't think she would. If they would have had me in for the free benefits check, whatever, under the insinuation that they did participate, or I felt that way anyway. And I'll give her a little credit. I kept trying to bait her into saying that that they're not participating with Delta because it doesn't pay enough, but she wouldn't go there. She kept it classy. So that was good. Now, when I told you my phone was going out, there's something I didn't even hear until I played this recording back. And I'll give her a little credit for this. Towards the beginning of the call, when I was started asking these questions, she said, "How'd you hear about us?" And I like that. Not only is it good information, how'd you hear about us, but she was in the process of kind of turning the call around. I was saying, "How much is this?" And she was turning it into a friendly call. Like if I'd said, "Oh, my friend Jim referred me." "Oh, Jim, yeah, that's so great. Let me tell you a little about our practice." Hopefully she would have done all that. So credit to her for trying to take control of the call and hopefully tell me more about the practice so that I will make an appointment. But in general, I think the key takeaway is 4 minutes of her time was invested, and she never, ever, ever even came close to asking me for the appointment. Let's try one more.
Our practice. For quality assurance, this call may be recorded. If you are an existing patient of our practice, please press 1. If you are a new patient and would like information about scheduling an appointment, please press 2.
Thank you for calling Dental. This is Edna speaking. How can I help you?
Hey, how much does it cost for a checkup and cleaning for a new patient?
So we do have to start with the exam and x-rays. That will be $89. Once we determine exactly what kind of cleaning is needed, then we can give you the exact pricing. Or regular cleanings are $99, so it would be the 99 plus the 89 if that's all you need. But if it's any other type of cleaning, they'll let you know at the time of them doing the evaluation.
So why would I need a different type of cleaning?
So it just depends on the condition of the gums and the teeth. If you have a lot of buildup, tartar, if you have inflammation on the gums, there's something called periodontal disease, depending on the condition of the gums. If there's bone loss, all of that affects what kind of cleaning is needed for that to be in a healthier state.
I see. Okay. And also, do you take Cigna dental insurance?
We do, as long as it's a PPO plan.
It is. Okay. Great. Cool. Well, thank you so much.
Not a problem. Thank you.
All right. Bye now.
Bye-bye.
Not a problem, but it is a problem. What is going on here? 3 calls in a row. I said that I was, told them I was a new patient in their practice or want to be a new patient in their practice. Asked a reasonable question, got some decent, some poor, some good answers, whatever. But nobody, I just don't get it. I mean, I've done hundreds of these podcast episodes. I know that thousands of people across the country are listening, but I don't know. Am I calling offices that aren't listening? Am I calling offices that just they freeze and they don't do it correctly? It's so easy to offer the appointment. So please don't make that mistake in your office. That's going to be it for today. I'm Dr. Richard Maddow, your host at the Dental Practice Fixers podcast. If you haven't subscribed yet, as they say in podcast land, hit that subscribe button so you always find out when new episodes drop. I hope to see you soon. Thanks.